Hi, I'm Virginia, and welcome to the Health Creators Podcast, where we talk about the impact and business side of being a health creator. Here with me today is Jeremy. Thank you so much for being here today, Jeremy.
Pleasure to be here, Virginia. I'm looking forward to our chat.
Yes, me too. So let's start. Who are you and what do you do?
Okay, I'm Jeremy Latham. I'm an orthopedic surgeon. I specialise in hip surgery. I'm in private practice now. I was in the NHS throughout my training and as a consultant for 17 years, but left a few years ago. And just do hip surgery in private practice, and I'm enjoying it immensely.
I love how you just casually say, I just do hip surgery. Like, it's an amazing thing that you do.
Yeah, well, it's a wonderful operation that was described by an eminent professor many years ago as the operation of the century. It's transformed the lives of millions and millions of people for the last 60 years, really. And of course, it was pioneered in the UK by Sir John Charnley, who was an orthopedic surgeon who really invented the modern hip replacement. And we've all benefited from that for decades.
Yeah, that's really brilliant. Thank you. It does seem kind of strange that we haven't had it around, for that long, and it's really revolutionized people's health.
Yeah.
So, what made you get into starting to create video content?
Well, I've always been interested in tech. I'm a bit of a techie, computers, cameras, audio stuff. So I've always dabbled a bit with that. When I was doing lots of lectures on the sort of the circuit a few years ago, I realised that there was an opportunity there to bring my skills in presentation and use what I know about how to present content, lectures to people, both peers and also to patients, and put those into a video format. And when I left the NHS, in order to sort of promote my private practice, I set up my video channel, The Hip Surgeon, and started to produce videos basically to show who I was, but also to provide information for patients who may be considering having hip replacement surgery. So it all started from that about 7 years ago.
Amazing. So here we are 7 years later, and you're still creating videos. So, what is your process to create a video?
Well, it's changed over the years, as you can imagine, Virginia. So, I've bought more and more equipment. As I say, all the gear and no idea. But I've learned a huge amount about how to use cameras, lights, audio, and how to edit videos. That's been quite a challenge, because editing videos is more of an art than a science. But you have to understand the software in order to get the most out of it. So I've learned sort of as I go, like most creators that I'm aware of, and grown those skills over the years to produce videos. Usually, it depends on what ideas I've had, but often I'll do maybe 2 a month. So the process starts with me thinking about an idea for a video. Maybe, why is my leg swollen after a hip replacement? A lot of patients ask that question. So I'll research that, put together a script. And I've been using scripts for a few years, and I find those very helpful. That helps me to put my ideas into a coherent form, which I can then present to camera. I use a teleprompter, which I've used the last couple of years. That's been transformational. And then put some B-roll bits together. I've subscribed over the years to various things like story blocks, using little clips of video and sound effects. So that's been quite interesting and exciting to use all that. Pull back a little bit from that now because of the expense as much as anything else. But it's allowed me to sort of create little videos, little stories, which I hope are engaging and give patients the information they need.
So, how long does it take you to create a video from start to finish?
That's a good question. Depends on the nature of the video. Most of my videos are under 5 minutes long, so they don't take a long time to create a script. So maybe an hour or two just to have an idea, do some research on that, and put the script together and rehearse it a little bit. So then I've got a little spare room studio. I can just switch everything on. Everything's set up in the right position. So it is a sort of fairly subconscious process. Just switch everything on, make sure the sound's on, make sure the camera's running, and then do my piece to camera, and then put it all together on the video editor. So the whole process will probably take me the best part of a day. By the time I've presented it, maybe reshot some of it, and then edited it and just make sure I'm happy with it before I publish it. So I guess you're looking about 6 hours or so to produce a 5-minute video.
Amazing. So, how do you share your videos with your patients or people that you know? What's your kind of method of getting people to watch your videos? The people that you make the videos for?
Okay, well, the way I share them is I obviously put them on YouTube. That's my main repository for the videos that I do. I've got about 2,500 followers now, I think. There's a few loyal ones who always watch my videos and always comment. So I'm very grateful to them. Um, but I tell my patients in clinic, if you're interested in knowing more about hip surgery, then have a look at the channel. Here are the details. It's on my card and on my website. So I don't push it to patients. I just say there's a resource there, and have a look at it. Interesting, I was in clinic yesterday, and one of my patients whose hip I did a few weeks ago, she came for her 6-week checkup. And she said, "Oh, my legs were really swollen the other day." So I Googled it, and who should come up but you? Because I'd done a video about leg swelling. So I said, "Well, isn't that fantastic? You hearing advice from the horse's mouth, so to speak." So I think there's a lot of people just exploring problems and questions they have about surgery, and my name seems to pop up quite often. So it's quite satisfying, really.
Yeah, that's really brilliant because I did see your top video is why is my leg swollen after hip surgery? And then you've got other ones like why do hip replacements dislocate and what wound problems could you have after hip surgery and then how to address those. So these are all really specific questions that essentially you are the best person to answer because you are the consultant hip surgeon. And so I think that you've really dug out a great little niche on YouTube. And so if someone is looking for very specifically what you are an expert in, and they are more likely to find you. And so you also said in your kind of intro reel on your YouTube channel that you want your videos to be the right information that's understandable and relates to them. And then your audience is more likely to make better decisions about their health. And you also talk about the benefits and harms and how likely they are to happen to me. So, with your videos, do you think they help to kind of cut through the kind of earlier conversations where you've given them the foundational knowledge and now you can really get to the personalization of the treatment and care that they receive?
Yeah, it's a really good point. I mean, one of the duties of a doctor laid down their GMC is that we have to involve our patients in helping them make decisions about the care they receive. And that might mean having no treatment. So it's very important to bring the patients along with you when you are telling them about what's wrong with them and what the options for treatment might be. And of course, that's a very important part of gaining informed consent. So anything we can do as deliverers of healthcare to bring our patients into the world of what we do and try and give them information which they understand, which isn't too much jargon, but is relatable to them and given by somebody who has experience of great in depth of what the treatment involves, and more importantly, what no treatment might involve. So someone comes to see me has a painful hip, I spend a lot of my time saying, well, actually, you don't really need surgery at the moment. You might do in a few years' time, but just live with it, take some simple measures to try and mitigate the symptoms, and then come back and see me if things don't get any better. So this shared care is an important part of our duties as a doctor. And I think video is a really good way of giving information to people which is relevant to them and in a way which is easily digestible and something they can come back to as well. Because that's the other thing about video, it's there. You can just keep dipping in and out of it and go back and look at another part of the video and gain more insight by navigating around somebody's channel and seeing what they've got to offer.
Yeah, I really love that because I think that's sometimes one of the things creators can forget is that once you've made something, it's there and it can be referenced to and
Yeah.
rewatched as many times as you like. It's kind of like when you have a book, but the book takes up space on your shelf, but your videos are online, so you can access them from anywhere and you can rewatch. And also, if you have any questions, then they will come to you because you're the person who created the video. So, in terms of a previous chat that we had, you mentioned that there are people who watch your channel from all over the world and they've actually come to be treated by you. So how does that feel as a health creator, that you've created something that has made someone travel to see you? And what's the furthest someone has traveled to come and see you?
Well, I had somebody from California. Um, a lot of my viewers, though, are from India. India is a very interesting country because obviously access to high quality healthcare is very difficult for a lot of people who live in India. And they find it difficult to get information. And there's quite a lot of hip pathology in India, interestingly, particularly things like avascular necrosis of the hip, where the bone in the head of the femur dies away through a necrotic process, often through use of steroids. Steroids are very commonly used in India, and avascular necrosis of the hip is a relatively common problem. So that's been one of the most popular videos with viewers in India because it's a common problem there, and they're looking for information about it. So yeah, California is one of the furthest places. Lots of people from Europe, but also from around the UK as well. You know, I'm Southern England based, and the reality is, of the people who want hip surgery, most of them are older people. They don't want to travel too far to have treatment. They want to be near their friends and family who will look after them when they've had surgery. So as often as not, if somebody contacts me from far away, I'll say, well, look, you're far better off having treatment nearer home, where you've got all the support and access to help if you need it, rather than coming all this way to see me and then traveling hundreds of miles somewhere else. So that's another important part of the channel, which has been very satisfying, is interacting with people in the comments and questions and being able to give them advice. Obviously, you can't give specific advice because I've never seen them, but just nudging them and pointing them in the right direction, I think, is a really important part of what we do as healthcare creators.
Yeah, I really like that story because I can definitely relate, because I think I have a big proportion of people who are from India who watch my channel as well. And it's exactly what you said. It's their inability to access the care that they need sometimes. And so they'll ask questions. And if you're in a position to help, then why not? If it only builds your authority. And of course, I mean, you're giving advice over the internet and you haven't seen them. So it's really important to be aware that, it's not something that they should really act on. So without really speaking to their own healthcare professional who knows them better. So do you include any kind of disclaimers or anything on the content that you create?
That's a very important point. You know, we cannot give specific advice because without doing a formal clinical assessment, you can't make a diagnosis and you don't know anything about that patient's other conditions. And it's almost impossible just with a few emails or messages to get a clear idea of what's going on with that patient. So we as creators will put disclaimers on our channels, and of course, if somebody asks questions, you will have to have that conversation with them. But one of the other interesting things is that people are hungry for information and how to access the right care for them. They don't really know the language to use to get that care, and that's something I think we can help people with as well. How to approach a doctor nearer home for them to get access to the care that they need, and that's a really interesting part of this health content creation and interacting with people, because I think it makes you a better doctor as well, because you are improving and honing your communication skills, which of course is the essence of what we do.
Yeah, I had a question about that actually. So, when you are creating content and you're writing scripts and you're thinking about the words that you're going to say on camera, does that translate into kind of your
Mm.
active practice? So, you're thinking about what you need to say, and then do you kind of have this switch that comes on in creator mode and you think, oh, actually, what's the best way to explain this? If I was filming this and someone was to try and remember what I said, what's this kind of most accessible way that I can say it? Do you find that the language you use with your patients in practice has changed for the better as a result of all of the health videos that you've created?
Yeah, I think it probably has. I mean, one learns all the time about how to interact with people, how to communicate, and actually going through this process of writing a script for a video is really informative in terms of how you deal with patients who are asking the same questions in a clinic. So I think the two are symbiotic in many ways, and mutually very. So, what's the word? I suppose, yeah, each benefits from the other.
Yeah, I would agree. And I think also when you have
Other
time to think about a story to tell for a video, then you might use that story when you are speaking to a patient in real life because you will have remembered, how much effort it was for you to think of that analogy or something, and then you can use that over and over again, and you might even improve on it to kind of create an updated video. So in terms of your resources, because I'm sure all of your videos are evidence-based, where do you kind of look for information in order to base your videos on, and how do you keep information up to date?
Okay, well, as part of my sort of continuing professional development, obviously I have to keep on top of our professional journals. So I'm a member of or a fellow of the British Orthopedic Association that produces the Bone and Joint Journal, which is our academic journal about orthopedics. And for specific stuff about hip surgery, there's the Journal of Arthroplasty. So I look at those every month when they come out. And I keep up to date with the evidence in my own particular field. But often there'll be some research questions that have been answered in a paper, which I think will be interesting for patients. So I'll use that as a topic for a video. And also hip surgery in the news, which celebrities have had hip replacement surgery. Talk a little bit about that because people can relate to that. A few years ago, Andy Murray had a hip resurfacing. That was very exciting for hip surgeons to see somebody, an elite sportsman, returning to top tier tennis, having had hip arthritis and a hip operation, which has allowed him to continue going for several more years. So it's all those little bits and pieces of news, research data, publications from the National Joint Registry, which is a very important resource for hip and knee surgeons in the UK. So all of those things will provide topics for conversation and hopefully for video production.
Amazing. So, what would your top tips be for people who are aspiring health creators? How should they get started?
Well, that's a really good question. I think it's the most difficult thing, I think, for those of us who don't or who've never done it before, and I include myself when I first started, is getting in front of a camera is quite challenging because we all feel a bit sort of shy about being in front of a camera. But once you've done it and once you've sort of got over that shock of seeing yourself and hearing yourself speak, it actually becomes a lot easier. So just getting on and doing it is the key thing. Obviously, you've got to have some enthusiasm for it because the way you project yourself and the energy you put into your videos will make or break a video. So I think that's a skill that only comes really with practice. It's projecting yourself to the camera, pretending that the camera is just somebody in front of you, and having a conversation with the camera, which is that virtual person. And I think that's the best way of breaking that embarrassment almost about being in front of a camera. And also talking about what you know. What are your strengths? You know more about your expertise than anybody else. So you're producing or talking to that virtual person about something which you know in depth. And I think realizing that and understanding that and playing to your strengths actually gives you a lot of energy, which comes across in the videos you produce and is much more engaging. But it's a challenge. And I think I look back on my old videos now and I think, oh my God, I've never done that way now. But you're continually learning from this process. And that's been a very exciting and rewarding part of this journey.
I agree. I think those are all amazing points to bring up. And part of the journey is the personal growth. And so, what did you use to get started? Did you go and buy all the gear and then get started? Or did you just start using your phone? What was your kind of strategy to get started?
Well, it's a good question. I had a mirrorless camera, a Panasonic GH4, which I'd had for a few years. So I just started using that. It was quite a good video camera, and we had a spare room which I used. And I just went onto YouTube and looked at lots of different channels of people who were giving advice about how to produce videos, how to set up a basic lighting setup, a 3-point lighting. what sort of audio equipment you might need. So as I said before, I'm quite sort of tech geek. So I just went onto eBay and bought some cheap softbox lights, bought a microphone, and learned how to use this. But if I was starting again, I wouldn't necessarily go down that path of buying equipment before I understood how to use it. I'd just pick up my phone. The iPhones now, Android phones, they're just so good. The audio and the video is just extraordinary. Really cinematic video you can get. Low lighting capabilities are fantastic. The microphones are really good. So just pick up your phone and start talking to it about what you know. That's the way to get going these days. And then as your skills grow, you can start looking at different types of cameras, different audio setups, and develop a technique and a style that's unique to you.
Yeah, that's brilliant advice. And I would definitely agree with everything you've said. Just pick up your phone and start recording. And the sooner you do that, the sooner you'll start that journey to improving. And so, what are you looking forward to learning more about? What are the kind of things that you want to start doing that you haven't yet or that you've been thinking about?
Yeah, that's a good question. I mean, it's quite a lonely process producing videos on your own. And I'm really interested in collaborating with other people. I think you get a lot more out of well, just the energy of putting ideas across if you can interact with somebody else who's interested in what you're doing or who has complementary ideas and skills. So you could spark off each other. So I think there's a great potential for more collaborative work, particularly with our own health content group, which YouTube has been developing for the last couple of years. So I'm looking for opportunities really to work with other people so that we could spark off one another and look at different ideas about how to get the information we want to get across to our patients in a more dynamic way, but also explore different avenues of video production, doing more stuff outdoors, different environments, getting involved in slightly longer form videos and exploring shorts as well. I think there's quite a lot of potential with short form videos, which are very engaging, and people can just pick them up, have a quick snippet of information, and then perhaps use that to get into your YouTube channel and see your longer form videos. So there's lots of different avenues you can explore, each of which I think are complementary to each other. But collaboration, I think, is the most important thing for me at the moment, is getting together with other like-minded people.
Yeah, I love that. And I think also as the community grows, there's more opportunity for collaborations as well. And I think you mentioned that you have already collaborated with some other healthcare professionals. Do you want to talk a bit more about that?
Yes, I mean, I've done a couple of interviews like this with a nutritionist, which is very interesting. Nutrition is a very interesting aspect of course, with all healthcare, but particularly in my world, where I'm dealing with older people who are developing a degree of frailty. So they need to look at what they're eating so that they can maintain good lean body mass and good bone density, because that's very important for preventing a lot of the problems we see in orthopedic surgery, and also helping to manage their hip arthritis and improving their outcomes. Also had an interview with a Pilates instructor. A lot of my patients do Pilates, which is a brilliant exercise for people who are middle-aged and older, who may have arthritic conditions. It's a really good way of maintaining core stability, balance, and strength. So I had a very interesting conversation with her, went to her studio, and that was really interesting as well. So those sorts of things really interest me, sort of stepping outside my own narrow world of hip surgery and opening up lines of communication with other people who could help my patients.
That's brilliant. I think that also helps to share that we're not working in isolation as healthcare professionals. It is a shared care kind of responsibility. So you see your doctor, your surgeon, your nutritionist, your physiotherapist for rehabilitation, your pharmacist for all your medicines and that kind of advice. So it's really great when healthcare professionals do collaborate and create something together, because often we're in separate locations and you never see your doctor chatting to your pharmacist or your surgeon chatting to your GP, because you're just too far away from each other and you're both busy doing whatever you normally do. So video is a great way to see us together. And you also mentioned in a previous chat that you are looking to start doing more live videos and figuring that out. So what's got you interested in doing live videos?
Well, I think live stream again is another format which has got great potential. It sort of reminds me of being in a lecture hall, at a big meeting and fielding questions from delegates in the audience, or even in some cases when I was on that circuit, moderating a session and taking questions from people in the audience and then putting that to the lecturer. So I think that brings another dynamic into how we communicate with our patients and with each other. So live stream has its own unique challenges because, partly it's the equipment side of it, but also keeping a live stream going, I think, requires quite a bit of work, responding to questions, fielding questions. And again, I think that's where collaboration comes in, because I think you need somebody assisting you doing that so that you get the most out of it, but particularly your audience gets the most out of it. So their questions are being answered in a way which is timely and hopefully relevant to them without losing your way. So I think there's some particular skills there which I'm keen to learn. But it feels like quite a daunting challenge setting up a live stream. But again, I think one's just got to get on and do it, have a go and see what happens.
That's a great attitude to have. And I think, you've gone on and done it with the creating the health videos. So why not move on into other ventures that interest you, because it helps keep things interesting as well, I think.
Yeah.
So thank you so much for your chat today. And if people want to get in touch with you, what's the best way to do that? Through LinkedIn or your YouTube channel?
LinkedIn, YouTube channel, all the details are there on the descriptions. LinkedIn, Jeremy Latham on LinkedIn. Easy ways to get hold of each other. So if anybody wants to get in touch, please feel free to do so.
Brilliant. I will leave all of the links to get in touch with Jeremy in the description box below. And thank you so much for watching or listening, and I'll see you at the next episode. Bye.